From the PEP Radio Newsroom, this is the hourly news blast. Qburgh is reporting 53 people were newly diagnosed in 2025 with HIV, marking a 54% decline since 2016. Allegheny County recorded the fewest new HIV diagnoses in its history in 2025, a major public health milestone shaped by decades of HIV activism, expanded access to prevention and testing, and advances in treatment. According to newly released data from the Allegheny County Health Department, 53 people were newly diagnosed with HIV in 2025, and that represents a 32% decrease from 2024, and a 54% decrease since 2016. This is an extraordinary public health achievement, and it is important that we recognize what these numbers tell us. Public health investments work, Allegheny County Executive Sarah Innamorato said in announcing the new figures. The milestone comes more than 4 decades after the beginning of the HIV/AIDS crisis, which devastated queer communities, while activists, volunteers, healthcare workers, and people living with HIV built much of the support infrastructure that exists today. In Pittsburgh, that history includes the Pittsburgh AIDS Task Force, founded in 1985 by Carrie Stoner and a group of volunteers as an offshoot of the Pitt Men's Studies Community Advisory Board. Now known as Allies for Health and Well-Being, the organization was created at a time when people with AIDS face not only deadly and poorly understood disease, but widespread stigma and discrimination. Early volunteers help people find medical professionals willing to treat patients with HIV and AIDS, connected them with legal and government resources, operated an HIV/AIDS information hotline, and provided companionship to people dying from AIDS through its Buddy program. The organization began offering HIV testing in 1987, 2 years after the first tests were approved by the FDA. We really were first on the scene, Allies CEO Mary Bakovich said. PATF was the public health initiative in many ways. Today, HIV is a dramatically different diagnosis. Modern anti-retroviral treatment allows people living with HIV to live long, healthy lives. People who achieve and maintain an undetectable viral load do not sexually transmit HIV. The scientific consensus, commonly known as undetectable equals untransmittable, or U equals U. People who are HIV negative also have highly effective prevention options, including pre-exposure prophylaxis, or PrEP. AIDS-Free Pittsburgh estimates that PrEP use in the region has increased by approximately 400% since the initiative began in 2015. AIDS-Free Pittsburgh, managed by the Jewish Healthcare Foundation, now brings together more than 50 partners working on HIV prevention, testing, treatment, education, and outreach. Allegheny County became the second county in the United States to commit to ending the HIV epidemic by 2030. The milestone belongs to the entire community, Richard Smith, vice president of the Jewish Healthcare Foundation, said. The organizations delivering care, the public health professionals coordinating these efforts, and the individuals who sought testing, prevention, and treatment all contributed to this historic achievement. That's part 1 of this story. We'll be sharing part 2 tomorrow. PEP Radio is available on the Live 365 app, the homepage at paequality.com, Roku, Alexa, and wherever you find streaming radio. Up next, we have the Meadville area weather forecast here on PEP Radio.